Welcome to the third video in the series on steps in endodontic treatment. In continuation to the last video on pulp vitality test, today we'll be discussing about electrical pulp testing. Electrical pulp test is different from the thermal test, as in thermal test we check for the response to a thermal stimulus, while in EPT we apply electrical stimulus. And when we apply electrical stimulus, what happens is that there is an ionic shift in the dentinal fluid within the tubules, which causes depolarization and subsequent generation of an action potential from intact A delta fibers. Now let's look at how do we do an EPT. Again, the same protocol follows like in heat test and cold test. We take a response from a contralateral tooth first, followed by checking response from the tooth in question. However, a major difference compared to thermal test is that the tooth should be dry and isolated well. And this can be done by placing an interproximal plastic strip like the mylar strip in between the teeth so that the electrical stimulus is not carried to the adjacent tooth. Another key thing to remember is that there should be a conductive medium like a toothpaste applied on the tooth to ensure that maximum current passes from the electrode to the tooth surface. Also, to complete the circuit, we need to hold the rear end of the probe. An important question here is, which is the optimal site for placing the tester? An area of high neural density will have a relatively fast and strong response and requires the least electrical current. Therefore, the most desirable area of assessment in incisors is at the incisal edge, where the enamel is thinnest or absent. The tester should be applied onto the tooth surface adjacent to a pulp bone, as this receives the highest nerve density within the pulp. And this position equates to the incisal third region of anteriors and the middle third region of posteriors. A recent study has revealed that the optimum site for tester electrode placement on molars is on the tip of the mesiobuccal cusp. Now coming to the limitations of pulp vitality testing. In all the tests we have discussed so far, we depend on the patient's response to the stimulus. There is a chance that the patient can give you a false negative or a false positive response. So false positive response is where a non-vital tooth appears to respond positively to testing. A false or positive response is seen in patients who are scared or anxious and would respond at an earlier phase anticipating an unpleasant sensation. And another reason might be when the tooth gets necrosed, liquefaction necrosis takes place, and because of the necrosed material remaining in the tooth, it would contact stimulus and give you a false positive. Contact with metal restorations may also result in conduction of the current to the periodontium, giving a false positive response. And the same might occur with inadequately dried teeth. A false negative result means that a vital tooth has not responded positively to testing. And this may be seen in teeth with incomplete root development, which have a higher threshold to testing and require a stronger stimulation than normal to elicit a response. This is because teeth erupt and become functional before the completion of neural development. So in these conditions, cold testing has proved to be more reliable than electrical pulp testing. Secondly, traumatized teeth following injury may not respond to thermal or electrical pulp testing due to nerve rupture. The pulps of these teeth, however, may still be vital as their blood vessels remain intact or have revascularized. Therefore, traumatized teeth should always be carefully monitored at periodic intervals as the nerve fibers may subsequently regain function. Also, patients with psychotic disorders may not respond to pulp testing, and individuals who are under the influence of sedative drugs or alcohol may either not respond or respond to a stronger stimulation due to their increased threshold to nerve excitation. This brings us to the end of this video.